Radiotherapy bunkers are heavily shielded enclosures that are designed to contain radiation from both direct beam and scattered sources, such as Linacs or high-dose rate brachytherapy afterloaders. The bunkers in the design shown are for use with medical linear accelerators. In general, bunkers will vary in design details. However, they all have some common key design features, such as primary shielding, secondary shielding, and in most cases, a maze. The maze allows ready access to the treatment room without the need for a heavily shielded door, although these are sometimes used, especially where higher energies are used in smaller bunkers. You will notice the bunker is surrounded on all sides by areas of public access. These may be corridors, consulting rooms, plant rooms, or control rooms. The shielding design is optimized so that the work in these areas can take place unhindered. In some centers, the design shielding performance will be partly based on occupancy levels, so that, for example, restricted access to the equipment plant rooms may allow less shielding to be used. The primary shielding is designed to attenuate direct beam radiation. It is normally constructed of high-density poured concrete and is typically 2.5 meters thick. The secondary shielding is thinner as it is required to attenuate radiation that has been scattered by the patient and the walls rather than direct beam radiation. A typical thickness might be 1.5 meters of high-density concrete. As appropriate, primary and secondary shielding is required to protect the areas above and below the facility and the rooms adjacent to it. Access to the bunker is by the maze entrance. This sometimes has a physical barrier, such as an interlocked gate. However, in Cork University Hospital, a light curtain is used. The bunker has clear signage indicating the status of the source within. For the Linacs, the 3 possible states reported are no possibility of radiation, no radiation but there is an immediate possibility of there being so, and a warning indicating that radiation is present. As you proceed into the bunker, the 2 dogleg design becomes apparent. Such a design often uses some enhanced shielding in the inner maze wall, which is viewable in the maze entrance, viewed from the treatment bunker, but has the advantage of a shorter maze with less scatter reaching the entrance. As we enter the main treatment area, we see the treatment couch in the room underneath the Linac, which is mounted on the back wall. Yellow and red emergency stop buttons, also known as hard reset buttons, are visible in the room, and these completely shut down the unit. Other emergency stops, known as soft reset buttons, which don't completely shut down the unit, but which do terminate the beam, are located on hand pendants and at the couch. An additional hard reset button is available in each of the engineering areas behind the Linac. These are accessed by the 2 doors on the far wall. The doors are interlocked with the beam and should be kept locked with the key removed when the facility is in clinical use. A further hard reset button is located in the Linac control room, and a soft reset button is available on the treatment console. Each bunker also contains a Linac light status indicator. As with the indicator at the bunker entrance, it gives a visible status report of the facility. The bunker has a last person out button situated near the maze. Pressing this initiates a timer exit sequence. It is important for the last person out to make sure that no one else remains in the room. Wall-mounted cameras are used to monitor the facility when in use. In operation, they are used to ensure patient safety. They can also be useful for commissioning and testing the LINAC. For example, they can be used to check the gantry is in its expected position. It is important that the timer for the last person out system is set so that it just allows enough time to exit the maze and make a confirm by pressing the confirm button. The reason for this is that when the timer is operating, it is technically possible to exit the maze and confirm, and then re-enter the maze with someone else reconfirming. If this is completed before the timer finishes, then the door interlock will be made and radiation generation is possible. In noting this aspect of the interlock sequence, it should be noted that the probability of an unplanned irradiation is very low. It would require unknown, unauthorized access to the bunker and a reconfirm of the interlock circuit without any observations that someone else is in the bunker. Since the confirmation is made with full visibility of the maze entrance from the control room, it is extremely unlikely that this issue will be realized in all reasonably foreseeable events. However, a short but sensible timer setting will mitigate this by engineering means. Just above the confirm button is a sign which displays the clinical status of the LINAC. Photon dose rates through the primary shielding from one bunker into the next can be as high as 18 to 20 microsieverts per hour for 10 MV FFF beams with full field size. These dose rates tend to less than 5 microsieverts per hour at the isocenter of the adjacent bunker, that is, where an employee might be setting up a patient. However, using 10 MV FFF beams clinically would require much smaller field sizes and there would be attenuation through the patient. Therefore, real-world dose rates in the bunker from typical patient treatments are unlikely to produce dose rates where a controlled area would be mandatory in an adjacent bunker where its own LINAC or KV system is not operable. The only exception to this might be where physics checks require long beam-on times at 10 MV FFF, which may need to be directed towards an adjacent bunker rather than at 0 degrees. Traditionally, concerns about neutron production have been ignored unless the LINAC was operating at energies higher than 10 MV. However, the threshold energies for neutron production for some elements used in the LINAC head are in the range 6 to 8 MeV. With the higher dose rates used for 10 MV FFF beams, neutron production must be considered. So the bunker is designed to ensure FFF beams do not compromise the relevant dose constraints. Nevertheless, for practical purposes, it is worth being reminded that activation of head components arises from absorption of neutrons. For a 300-second run at 10 MV FFF, activation of the LINAC head is similar to that expected from a 15 MV machine. Dose rates up to 20 microsieverts per hour on the bottom surface of the head and 8 microsieverts per hour at the side of the head are observed. Dose rates 1 meter from the head may reach 5 microsieverts per hour depending on position relative to the head. The half-life of the combined activation appears to be around 8 minutes. Activation is something to be considered if regular use of 10 MV FFF is envisaged in the future.